Welcome to Science Corner. I am joined today by Dr. Josie Burridge, who has just joined the SuppCo Research and Science Team. She's a research scientist focused on making health science more personal and practical. She studied biomedical engineering before earning a master's in precision nutrition and a PhD in epidemiology. Her work spans the microbiome, biomarkers, and biological pathways with expertise in study design and data science. She evaluates research critically and translates complex evidence into clear, actionable insights to support evidence-driven health decisions. Josie Burridge, welcome to SuppCo and welcome to Science Quarter.
Thanks, Jordan. Very excited to be here today.
So I'm excited as well. So you are besides me, you're the first scientific hire at the company. We now essentially make a science team of two. We've doubled the science team with
Yep,
you joining, and I'm very, very excited to have you on board. And so we're going to use today to kind of talk about your background, get to know you a little bit, and introduce you to the rest of our users and the community, so they know where their information is coming from, and essentially the qualifications behind the people providing it. And
sounds great.
so because of that, you have a very interesting background, one that blends science, you blend research and communications. And so taking all that together, you can go a lot of different ways. And what initially brought you in or drew you to the supplement field specifically?
Yeah, that's a great question because it definitely was a winding road to get here. I tried a couple different paths before I kind of found, this area that I'm extremely passionate about. So I started in, as you mentioned, biomedical engineering, specifically in global health design. And so I spent a lot of time during that period working in hospitals, typically abroad, typically in settings where the patients didn't have a lot of access to consistent medical care. And so at the time, even though I was focusing on devices, I worked a lot with the providers who sort of were trying to figure out how to prescribe healthcare regimens of some sort that didn't rely on like traditional pharmaceuticals or access to care. And so I learned a lot about natural medicines, like nutritional interventions, supplement interventions, things like that. And I was just absolutely fascinated by this approach to care and kind of how effective it was. And so from there, I did, a complete pivot, staying in the health space, but moving away from devices and into my master's of precision nutrition. And from there, it just kind of snowballed over time where not only did I want to be able to help kind of disseminate this information and got involved in content generation, working for brands, things like that, but I wanted to learn how to do the research that I felt was missing and then synthesize what was out there to kind of communicate it better. Um, and so from there into my PhD, it kind of led me to where I am today in this position, and I couldn't be more excited.
I love it. And so going through this whole journey, was there a moment or an experience that made you realize, oh, this is what I want to work in? This is an area that I think is where I really want to devote a lot of my time.
Yeah, I think it was really through kind of the personal interactions with people who had had their life change in some way, like through these natural medicines. And so I think when, I started my PhD, I started working at, labs that focused on pregnant populations or people with rare diseases or things where it's kind of iffy in what kind of pathway of care to take. And so a lot of times people would go for sort of natural medicines with the hope that it would kind of change the severity of their symptoms or, help boost energy or help reduce pain or things that, kind of the traditional medicines hadn't helped them with yet. And people were really coming to me and saying, I started taking magnesium and I actually am sleeping better. I started taking vitamin B's and all of a sudden I am feeling my energy get better. And you start to see that people can really take control of their health in a new way that's, extremely accessible and extremely kind of personalizable. So it can change every week, it can change every month, kind of as people grow and change in their life. And I think that's a really powerful space to sort of help provide information for people to make those decisions over time, throughout the life course.
I love that. I love that. And so you're stepping into the supplement space. You've joined SuppCo. As you've stepped into this area, what has really kind of surprised you the most about working within this crazy world of supplements?
Yeah, I'd say how passionate the people are that work in this space. I think it's the first time I've worked in an industry where a lot of times people not only have kind of personal stories a lot of times of how, they have used supplements and how supplements have, changed the way they feel in some way, but they're also extremely passionate about then providing this information to others so that, if it's the right fit, others can sort of help themselves in the same way. Almost everyone I talk to is trying to figure out like how do we provide the right information to the right people, and they really, really care about being successful in that message. And so I think it's been really nice and really inspiring to feel like I'm constantly like learning and sort of building on the enthusiasm of, the people I work with.
I love that. And you said something there about providing the right information to the right people. And one of the ways that we do that as scientists is through research. And you're very, very well adept at study design. You spend a lot of time working in this space. And so one of the things that we hear a lot in supplements is, research backed, ran a trial, studies show, and we see this all over the place, whether it's in brands or advertising, et cetera. And when you look at these studies, when you look at a study for the first time, what are the first two or three things that you do to just quickly assess, like, oh, this is okay, or maybe not quite as intended?
Yeah, so this is a great question. One I could talk about all day, but I will try to keep it high level. I think the first thing that I really look for is that the research question is very well defined.
Mm.
I think a lot of times the best studies are built on a very, very clear research question. Because then from there, the researchers can determine, what's the right population for this? Like what's the right type of supplement or dose, route of administration, what exact outcomes are we looking at and how do we measure them? When researchers kind of go in with this really clear framing, oftentimes it's like the foundation for a very strong study and appropriate study to be built on that research question.
So you said a lot of things there that make a study good. What are
Yeah.
those red flags that you look for when you see a study and you see what's the uh-oh moment when you're going through these kind of, especially in the supplement
Yeah.
space?
So I think one of the things that I see the most is that the type of claim being made is stronger than the study design behind it. So when you're looking at different types of studies, oftentimes, the strongest types of studies are typically randomized control trials, or some sort of synthesis of several randomized control trials to say, we were able to really standardize our population, have some sort of placebo and exposure, and then see that this was the only thing that changed, and then this was the effect. We can probably attribute it potentially to the exposure. However, because it's very costly and very difficult to do this type of study, a lot of times we rely on something called observational data, which is basically watching what people do and then watching what happens. And so when you have observational data, you can't isolate it to say, this action, like taking this supplement, causes this reduction in symptom or causes this outcome. Like you have to be very careful with using appropriate language for the type of study. And I think if you're not, and most people aren't aware of kind of the study designs and what the implications are. So it's kind of on the researcher at that time to appropriately translate the strength of their finding and how it what it actually means and how kind of the average person should interpret that information. And so I think that's the biggest red flag where I see that interpretation isn't quite right for the type of study behind it.
And so I want to go a little bit deeper there. So when we talk about, you mentioned like the average person understanding science. So I have a PhD, you have a PhD in epidemiology, you have many other degrees, precision nutrition, et cetera. This is kind of an easy thing for you to do to look at a study. But for someone who maybe doesn't come from a scientific background, how can they really look at a study and quickly understand how to interpret it or even if it's valid or not?
Yeah. So this is a great question and actually think one that answers a little more nuance than I wish it was. I think because there are so many aspects that go into a study, it's, the population, the design, the outcome measures, the adjustments, everything together that it is difficult for the average person to take a study and just know if it's valid off the bat, which I think is why something that really drove me or, like drew me to SuppCo is that it's kind of, I think, more important for people to find an organization that they trust who does the work of translating this raw scientific information into like, here is the takeaway from it for the average person. Here's what it means. Here's the strength of it. And here's how you can apply it. So I think for the average person, what I would recommend is finding an organization like SuppCo who's kind of going to be able to translate that for you and someone that you can trust where you can respond with comments, they'll respond back. And take away a little of the guesswork.
So I like that. I mean, personally, I like that a lot. If the answer
Yeah.
is don't worry about it, we'll do it for you, that's great. But I think you're completely right in making sure that as a consumer, as a user, that you're finding a place that you really feel comfortable in, that you trust, that is giving you information that feels unbiased, and then that you can really move forward with. I think there's a reason why I joined, the reason you joined. I
Mhm,
think SuppCo is a very good place for that. I think that's a nice way of approaching it. So I want to talk a little bit more about research in the supplement space. And,
mhm,
we see a lot of research around ingredients, nutrients, whether it be CoQ10, vitamin D, urolithin A is one we see a
mhm.
lot around. How much weight do you think a single study should carry when evaluating an ingredient? And I ask this because a lot of brands will go out, they'll put their one study out and they'll say, our
Mhm.
thing works. It's great. It's fantastic. Talk to me a little bit about this.
Yeah. So I think research in the supplement space is still up and coming in a lot of areas. So I'm always happy to see research, especially high quality research being done, right? Like there has to be the first one before there can be the second one. Um, I think in terms of how you're interpreting it as a consumer, I think one research study being done in general should indicate to you maybe there's something here and like maybe it's something I should pay attention to and watch for more studies to be done. When it comes to looking at that individual study for weight, generally speaking, if it's a randomized control trial, a I guess meta-analysis wouldn't be the one study, but a randomized trial or a large scale observational study, that's probably gonna be a little bit more reliable than, um, a very small study with 10 people on a very specific population. Um, so I think that's a starting point, is looking at the study design. That being said, I don't think you should necessarily take any singular study at face value, as an absolute truth. I think it's just kind of a starting point.
And I think that's interesting. One of the things that we talk a lot about in science is this concept of replication. And it's exactly
Mhm.
what it sounds like. If you
Yeah.
can do a study once, you should be able to do it again and again and again and see similar results. How do you feel about this concept of replication? And do you see it being applied right now in the supplement space?
I do to an extent. I think we're still early enough that there's not as much maybe on some of the vitamins that are a little bit more common, more research has been done, zinc, vitamin D3, some of the Bs. We see kind of a higher volume of studies where there is some replication. Um, I think something that I really think is great is a lot of times the trials that have a smaller sample size, like maybe it's only been studied in people with a lower baseline or that have a specific clinical condition. And now we're seeing studies that are expanding to a more general
Yeah.
population, trying to see like, is the effect we saw in these specific populations, does it translate to kind of the more general average healthy person that's interested in using supplements? And I think as kind of the research expands, we'll start to see more replication. And I think that's when people can truly build the confidence to sort of the highest level of understanding what that nutrient is doing for them.
Got it. That's interesting. So you took that a little bit different direction than I did, which I think is great in the sense of we don't necessarily need to replicate the same study again to see the same results, but we can open it up, expand it, and see how those results kind of build. Is that what I'm hearing?
Yeah, so I think it's great when we can replicate the same study, same population, and see the same results over time. Um, I think that, in my opinion, we're a little bit a ways away from doing that for most supplements, just because of where kind of the state of research is. We're still, early, especially in the newer ones like urolithin A or berberine, and kind of the things like hitting the scene a little bit more. So I think the first step is really opening the research to sort of larger samples, more rigorous designs, and kind of broader populations. And then hopefully from there, we see more of the replication sort of in the same populations to strengthen our findings.
Yeah, that makes a lot of sense. And so I want to expand on that a little bit. So your PhD is in a field called epidemiology, which
Mhm,
for lack of a better word means you can handle a lot of data really well and be able to understand it. And so one of the things that happens a lot in this space, and I see it every day, you're seeing it now,
mhm,
people love to read headlines. We read abstracts. We
mhm.
see vitamin D cures cancer or CoQ10,
Yeah.
you know, prevents heart disease. These big bold headlines that when you look under the hood, it's probably a little different than what we're seeing.
Yeah.
As a lot of people are doing this, reading headlines, abstracts, what do you think gets lost when people are not actually understanding the full data and what can they do about it?
Yeah. I think a lot of times what gets lost is the population being studied itself. Like
Interesting.
for example, like one that I was just looking at the other day was, for example, there's a lot of research right now looking at like kind of stress reduction supplements. And so you'll see things for like nutrients like 5-HTP that kind of affect like serotonin production and regulation in some way, and there's a lot of evidence for, this might help with mood regulation. And so people see the headlines, they say, oh, I want to reduce anxiety or lift my mood or something, I'm going to take 5-HTP. But when you look at the details a little more, you see some disclaimers like, hey, this might interact in some way with SSRIs, or this maybe has been studied in a specific population. And so what might have been a finding for the population the study was done in might not be a one-to-one translation of like how it could affect you, given your personal biology, your, current stack of your exposures, things like that. And so I think while it can feel like more daunting when you're like, I have to personalize everything for myself, um, there is a level and when choosing supplements and looking at research that, it is important to look at what's my biology. Is this study done in populations similar to me, to sort of understand a little more if it's actually relevant for what you're looking at it for.
That's great. And so, as someone who really truly understands what's happening at this level, how do you personally take this complex data? We see it all the time, and you're dealing with it. You're analyzing it. How do you actually turn it into something that's really useful for real world decisions?
Yeah, I think for me, my starting point is typically my biomarker data. And I think that that's becoming a little bit more mainstream. More people are collecting their information. I think in order to kind of make sure I'm tailoring my supplements to what I might need, in that era of my life, I do like to look at my blood work and sort of see where my levels are. If a certain nutrient is like, higher, it might not be something that I prioritize versus if I'm like nearing towards low values, that might be something I add to my stack. If you don't have biomarker data, then I think it's a little bit more sometimes of a trial and error process. If you're really like checking in with yourself and thinking, I want to prioritize, energy. You can start with kind of those general, more well-studied supplements and just see how you feel. If
Mm.
you're not feeling the way that, you're hoping or you want to make a change, try something else and then kind of check in with yourself over time. Um, I think starting generally with a baseline stack of what's been well studied, things like magnesium, zinc, B's, creatine, like things like that, and then venturing into kind of the newer supplements is a good starting place for kind of more people just dipping their toe into the research.
Yeah, I like that a lot. I'm a big proponent of get the foundation first before you
Yeah.
start, get the trunk before you start exploring the branches and the leaves. Also love the nod to biomarkers. For those that don't know, SuppCo has a biomarker feature where you can upload your own personal biomarkers and blood data and get personalized recommendations for supplements based on your results. So check that out if you haven't already. So, Josie, one of the things that I know that you're passionate about, and that is correspondingly getting a lot of interest in the supplement world right now, is
Mhm.
supplements specifically suited for women's health. I think
Yes.
traditionally we've done a terrible job where we've just thrown a supplement in
Mhm.
the world and say this works for everyone, and now we know that it really doesn't. And so, as the topic of women's health has been getting a lot more attention recently in the supplement world, what are we still getting wrong, and where do we need to go next?
Yeah. So I think that we're definitely creeping in the right direction, and I'm more and more excited, like kind of as the months go by and I see these new products coming out where the formulations look great. They were clearly designed by people with strong backgrounds in women's health. So I am very excited with the way things are going. I think that a lot of times it's still being kind of oversimplified in a way where, you have these specific stages that are premenopausal, perimenopausal, and postmenopausal. And then people are like, okay, here's a female supplement for this whole, block of time. And while that is a step, absolutely a step in the right direction and a great foundation, there's still a lot of changes that go on in, the average woman's body week to week in terms of just kind of hormonally where things are at, symptomology that each person has that might be a little different and kind of individual needs. And I do think that we can go a step further to kind of personalize in a way that would support women kind of throughout cycles within the month rather than just a block of like this is 20 years of your life. Here's one supplement for it, if that makes sense.
I mean, I think it makes sense. As
Yeah.
as someone who's not the target market for this, I think
Right.
I agree. I think it's time for us to be evaluating this at a much deeper level, and I'm glad it's moving that way, and I'm glad that you're keeping an eye on it for us as well. And so, within this world of women's health supplements, where do you think that the science is strong, but we're not yet kind of expanding upon it, or we're not taking advantage of this area quite yet?
Yeah, I'm gonna piggyback off my last answer for women's health. I think the science in terms of what a woman's body does hormonally week to week in a cycle, or when they're taking, oral contraceptives or other kind of like common types of medications that women might be on, there's very strong science of what's happening biologically during that time. And then also what types of supplements might support you, when your body needs to metabolize, estrogen more efficiently, or other things might need to happen. Obviously, not a replacement for medical advice, medical anything like that, but we do have a lot of information that might enable kind of more personalization. And I don't feel like it's being capitalized on yet, but I do have a feeling it's kind of in the ether and people are starting to pay more attention.
I love it. Well, as that comes out, we're definitely going to be talking about it and letting people know what's changing and what we like and what we don't like. So I want to wrap up here. I want people to know a little bit more about you. And so, what is one supplement that you personally cannot go without? And what is one flying under the radar that you wish more people knew about?
Okay, great question. Right now, I creatine is one of the ones that I'm just not going without. I think as someone who spends a lot of time in the research, there's just more and more exciting things with creatine related to just healthy aging, cognition, things like that, that make it something I'm very kind of excited to continue taking, continue kind of altering my dosage, find the sweet spot, and something I do feel effects from when I take it over time. So that's one of my most consistent ones right now. Something that's flying under the radar. I would say glutathione is definitely one that's flying under the radar, a master antioxidant. But I will go one step further and say, for me personally, MSM is one I've talked about with you before, but I do think that it goes under the radar for the general audience, where that's a precursor that kind of helps your body produce glutathione and also helps your body produce collagen. So that's something that I like to take to sort of support glutathione production as
I
well.
love it. I love it. I love it. Dr. Josie Burridge, welcome to SuppCo. Thank you so much for joining Science Corner. We're excited to have you here. For anyone listening, keep an eye out for Josie's videos and articles that'll be coming out from SuppCo soon. We're glad to have you.
Thanks, Jordan. This was great.